It is important that mower producers are familiar with the concepts of anthelmintic resistance, refugia, target selective treatment, and pharmacia before dosing. For information on roundworm management, speak to your veterinarian. Make sure you have carefully read the instructions of the anthelmintic dose. Check the smoothness of the nozzle. If rough, the nozzle can cause small abrasions on the lining of the mouth, which can result in painful cellulitis and abscess formation. Use dose guns with shorter nozzles. For example, calibrate a 10 ml dose and dose into a 10 ml syringe casing or a 100 ml measuring container to see it is accurate. Do a pressure test by placing the nozzle against your hand and try and depress the plunger. It should not move. Weigh a few of the goats. Do not simply guess their weights. If there are significant size differences in the goats, then separate them into similar sized groups. Dose for the heaviest weight of the goat. An assistant should be used for better control of the goat. Approach the goat from behind in the race. Hold the goat's head with one hand on the base of the horn and other hand under its chin to hold it securely in place. Tilt the head slightly to the side so that you can see the mouth. The head should be raised only slightly. If the head tilts too far, some dose may pour out of the mouth. Pulling the head too far back can prevent the goat from swallowing. Slot the nozzle in the gap between the molar and the incisor teeth and then over the back of the tongue. The nozzle must not be too deep, as this will prevent the goat swallowing and possibly damage the back of the oral cavity. The correct position will be to place the tip of the nozzle on the back of the tongue, roughly vertically in line with the eye. The nozzle must not point directly down the back of the throat, but to the side. Press the plunger slowly. As you give the dose, tighten your grip on the goat as it will try and move away. As you remove the dose gun, keep a firm grip on the goat's mouth and head and allow it time to swallow. If you release the goat before it swallows, the dose may leak out of the mouth or the goat may spit it out. Record the identity of the goats, the date, the dosage, and the product used.